Hey everybody, BK with Masada Tactical here again with another video. So it's been a while since the last video we took, and I figured I'm gonna kick kind of the reintroduction of videos with a question rather than with me trying to impart some knowledge and skills on you. So I'll give you a little bit of background. I taught a class last week. It was a TCCC class, or Tactical Casualty Combat Care, which is what DoD and the military uses to train soldiers and other warriors to address the what we consider the preventable causes of death. So we talk about extremity hemorrhage, we're talking penetrating chest trauma, and airway obstruction. Half of the class is medical, and the other half of the class is tactical, where we actually shoot, we engage threats, we drag people around, we treat them under fire, and so forth. So while we're doing this range session, one of the days, we worked around a vehicle, in and around a vehicle, shooting from a car, engaging threats, treating patients, pulling them out, and doing all that kind of stuff. And I was sharing some of my way of fighting from a car. We're talking about how to set things up, where to carry a gun, how to shoot, all that sort of good stuff. And obviously when discussing how to carry a gun, I advocated the appendix carry, just because with a seatbelt on, it's a lot easier for me to draw and shoot if I need to. I don't have to kind of mess around and trying to reach something in the back, or even thigh holsters are not comfortable, especially if you have a large center console, and so forth. I'm a big fan of whatever works for me outside the vehicle should work for me inside the vehicle, and vice versa. So if I have one skill that can work in both, that's the way I like to go. And that's the way I've been teaching for a while. Luckily for me, always being the student, sometimes the instructors, but always the student, I had some people in the class that I could learn something from. And I had some paramedics, I had physicians, and I had some tactically oriented individuals. And one of those physicians actually mentioned that they've seen a rise in severe pelvic injuries from people carrying in the appendix carry position. And then if they get into a vehicle accident, that pressure of the impact from the steering wheel or even the airbag against that piece of steel, driving it into the pelvic bone, is creating catastrophic injuries. Considering the femoral artery runs there's some other major blood vessels in the area. The bone itself is fragile and delicate. So he advocated carrying actually in the 4 o'clock or further back. The discussion ensued, which one is the better one? Carrying in the 4 o'clock may prevent those injuries from happening, but makes it harder for me to shoot or engage a threat in case of an ambush. Carrying in the appendix, I can draw and shoot very fast, but I'm taking the risk that in case of an accident, I am going to have some traumatic injury to my pelvic bone. So this is the question to you. Which one would you do? In my mind, it comes down to, let's identify which one is the greater risk. If I'm operational as a police officer working undercover, or if I am doing a protective security detail, then I may carry up front, because rolling into an ambush is a higher risk than getting into a car accident. But if I'm back home, driving around my family, and the chance of me going into an ambush is pretty slim, then maybe shifting the gun back does make a little more sense, as car accidents are very prevalent in society, and that may be my greater risk at that point in time. So I want to ask you, and by all means chime in, comment, send me messages, let me know, where do you carry in a car and why? And hopefully moving forward, I can account for that in my training and develop tactics around it and around your feedback. So thanks in advance. I'm looking forward to sharing more videos with you soon and getting back on track. And you all stay safe out there. Watch your six.